Welcome to another program service spotlight from the Northeast Iowa Area Agency on Aging. My name is Mike Donahue and I am honored to serve as the CEO for NEI3A and excited to introduce our service coordination program, which includes case management, options counseling, and our Iowa Return to Community. NEI3A serves individuals age 60 and older, caregivers, and all persons planning for future long-term services and support. One of 6 area agencies in the state of Iowa and one of 626 across the country, NEI3A is committed to empowering older persons, persons with disabilities, and caregivers to live in the setting of their choice. Services have no set cost, and the agency utilizes federal, state, local funds, and voluntary contributions to support our mission of providing programs under the Older Americans Act. At this time, it's my pleasure to introduce our Regional Director and Resident Service Coordination Expert, Kara Furch.
Options counseling and case management. When an individual needs more specialized assistance, they are referred to case management or options counseling. While the service provided to the client is similar, the main difference is options counseling is short-term assistance, 90 days or less, where case management is anything over those 90 days and oftentimes ongoing. For both options counseling and case management, a home visit is conducted to assess the safety of the home environment, a full needs assessment is completed, and a care plan is developed which includes services and providers. We then explore all funding options. The aging specialist then coordinates the services on behalf of the client. We put a strong emphasis on client choice throughout this process, meaning the client is always in control of their plan, and we never force services or providers that the client does not want or approve of. Application assistance may also be done during this time. Common applications that we assist with include Medicaid and waiver applications, SNAP benefits, LIHEAP, low rent housing, and rent rebate. It is important to note that all of these applications are ran through an outside agency. Once the application is submitted, we no longer have access or control over the application or the application process. NEI3A has Older American Act dollars that we can use to pay for in-home services. The primary services we fund are homemaker, chore, nurse, personal cares, and lifeline. A client must meet our internal funding guidelines. Those guidelines look at annual income, resources, and a priority score, which is determined by the client's ability to perform ADLs and IADLs. Access to these dollars is also based on if funds are available. The demand for these dollars is often greater than our budget, which causes the need for a wait list. Older American Act dollars must be used as funding of last resort. Clients who receive Older American Act dollars will receive a contribution statement. At a minimum, clients enrolled in options counseling and case management will receive the initial home visit, monthly phone calls, and quarterly home visits. Iowa Return to Community, or IRTC. The goal of the Iowa Return to Community program is to prevent, reduce, or eliminate ER readmissions along with hospital readmissions. To qualify for this program, the client must be 60 years of age or older, live within our 18 counties. They cannot have full Medicaid benefits and be assigned to an MCO. An example of this would be being approved for a waiver. However, they can be approved for limited Medicaid, such as medically needy, Medicare Savings Plans, MSP, Qualified Medicare Beneficiary, QUIMBY, or specified low-income Medicare benefits, SLIM-B. They must have been discharged to the community from a hospital, long-term care facility, or skilled nursing rehabilitation facility within the past 2 weeks of us receiving the referral, or referrals from medical clinics with concern of a hospital admission with no prior admission can be accepted. The client must also agree to participate in the program. Enrollment in the IRTC program cannot exceed 90 days. Any ER or hospital admission during the 90-day approval will reset the 90-day enrollment. Should needs still exist beyond the 90 days, the client can transition to our case management program. During the enrollment period, the aging specialist works very closely with the medical team. The process for IRTC looks very similar to case management and options counseling. A home visit is conducted to assess the safety of the home environment, a full needs assessment is completed, and a care plan specific to the individual client is developed. Services and providers are discussed, and funding options are explored. The aging specialist then coordinates the services on behalf of the client. Application assistance may also be provided. All clients enrolled in this program will receive at a minimum the initial home visit and monthly phone calls. Any I3A has specific dollars to be used towards this program for in-home services like homemaker, nurse, home health aide, and home-delivered meals through Mom's Meals, along with transportation to upcoming medical appointments. Clients who meet the qualification for this program are eligible for IRTC dollars up to $500 a month as long as IRTC dollars are available. A key distinction to this program is the 30, 60, and 90-day post-discharge phone calls that are made to track any readmissions that may have occurred. Although not a requirement of this program, in some locations we have aging specialists going into the hospital to meet potential referrals bedside. Also, in some locations, we have access to the healthcare system's electronic patient record system, so hospital discharge planners can make referrals to us from the system they are already working in, rather than calling lifelong links. At this time, IRTC is one of our largest referred programs.
Thank you for your time today learning more about NEI3A and the services in your community. If you have any questions about our service coordination program or would like to make a referral, please contact us at 800-779-8707.